Hello, Dr. Sir. બે હમણાં હું ખાલી introduction કરાવું છું ને તમે પછી ચાલુ કરી નાખો છો. Just we open your videos in next 1 minute.
Okay, તો મને WhatsApp કર.
હા ના તમે no problem. Assalamu alaikum. My dear brothers, sisters, elders, colleagues, and all of the community member, wherever you are, Assalamu alaikum. Today we are having an introductory webinar, Zoom meeting. And if they are to talk about the COVID and what it's all about and prevention and everything. And if there are any questions, please let me have them. And Dr. Sharif will try his best to answer it. I'm handing over to Dr. Sharif. Doctor, over to you.
Thank you. So, am I on sharing screen share? Yusuf, can you hear me?
Yeah, I can hear you.
And can you see the slide?
Not as yet.
Not as yet.
Okay, doctor, it is there.
It is there.
No, it is gone again.
Okay, let's try. Is it there now?
No. Screen share is not coming. I can't see. Just a second. Are we sharing it?
Wait. Can you see it now? Yusuf, can you see it?
I can see it. You can go ahead. Yes, I can see it. I can see it. You can go ahead.
And you can hear me, right?
I can hear you. I can see you. Yes.
Thank you. Okay. Good evening, everybody. I will maximize put it on a slideshow so that all of you can see it better, okay? My name is Dr. Sharif. I work at the Jaffrey Medical Center, and my topic today is what is COVID? And this is information for our members.
I work at the Jaffrey Medical.
Now, COVID, what is this disease we are all talking about? It's an outbreak which started in December 2019. It was identified in Wuhan, China. The virus has since then been named SARS, and SARS stands for Severe Acute Respiratory Syndrome, CoV-2. So the name of the virus is SARS-CoV-2, right? So do not get confused between COVID and SARS-CoV-2, right? So the name of the virus is SARS-CoV-2, and the disease is called COVID-19. It is coronavirus disease, and 19 stands for 2019. This is how usually viruses are named. They do not like these days for a virus to be named after a country or a name of a person. Now, this slide is a little bit old, right? But as you can see, worldwide reported cases of COVID have dramatically increased. They are over around, I think today maybe over 3 million cases. Billion, not million, billion. We're talking about billion. So we are talking about from January when China started reporting up to now, it's 3 billion cases, and the number are doubling every day. Okay. Now, what is a coronavirus? Coronaviruses are not something new, and they are called corona because if you look at the slide, this slide looks like a on a microscopic view looks like a crown, right? So that's why they are called coronaviruses. And they have been there for many years. They cause several diseases in animals and birds. In humans, coronaviruses cause the respiratory infections, which are usually very mild, including some cases of common cold. So when you're talking about coronavirus, it is actually responsible for your common cold. But when we go to SARS-CoV-2, then it is we are talking about a serious disease. Right? Now, the SARS-CoV-2, the novel coronavirus that appeared in 2019, causes an acute respiratory disease called COVID-19 for short. Okay, the disease is thought to have originated from animal to human, and then spreads from human to human. So animals which jump from infections, viruses which jump from animal hosts to human host are usually classified under a study called zoonosis. There are a lot of these viruses which are usually in animals, right? But they jump over to humans, and a lot of them will disappear in humans once you control the animals. Like, let's take, for example, Rift Valley fever. Rift Valley fever is an endemic virus in animals, especially camels, right? But it spreads to humans occasionally once in a while. So it is what is known as zoonosis. Now, COVID-19 is related to a previously known disease known as SARS, which was there during 2002, and then Middle East Respiratory Syndrome, which are caused by different but related virus. So they all belong to a class of virus known as coronavirus. Right? Now, this is the chart of how the virus has been spreading. Now, this is on a log screen, right? In Kenya, 14th March, we had one case, then it goes up. So these are daily reported cases, right? It's not the cumulative, right? And I've charted it up to the 14th of May. But as you know, today, there was a tremendous increase. Then this is the United Kingdom. They started off at a lower, on March 14th, they were at around 800 cases, then went up on a daily basis, right? So they've been staying around roughly over 1,000 cases per day. Germany started off with less than 100, around 110 cases on 14th of March, increased to over 1,000, right? They've dropped down to less than 1,000 now. So in Germany, we can say that definitely the curve is going down. So I only decided to choose these three countries, but there are, there are other countries which have more cases than England. Like you have the US, which has, I think, the largest number of cases in the whole world, right? Followed by Russia. So these figures keep on changing. They keep on changing every hour. As soon as there is a notification, you can actually go to this our World Data Organization to get a daily update. Right? Now there was a question which was asked: how is it spread? Now, the mode of spread is very simple right now. Right? You have one infected individual who is coughing. Now, when he coughs, he produces this droplet. Right? Now, the droplet will drop down. And then he also produces a droplet nuclei, which will go to another person. Right? These are the droplet nuclei, and if this individual is susceptible, Means susceptible meaning he doesn't have a mask, he does not have anything protecting him, may get the disease. So this is infected individual, droplets which will drop down, some which I will be floating in there for a few minutes, maybe half an hour, some to 1 hour. Then it will go to the next individual. Or the other case is this droplet will drop to a surface. Let's take, for example, a chair, a table, or a handle, or a car handle. It will drop on the handle of a car, and this person who is susceptible will touch it and get infected. So there is airborne contact, then there is the direct contact from this uh, piece of furniture he has handled. Right? And usually,
Doctor, if you can speak a bit more louder in the mic.
okay. Now,
Yes, thank you.
Okay. Usually, this one, the indirect spread is when somebody touches the contact. Let's take, for example, top of a table with his hand, right? And then brings it to his face, either the nose, the mouth, or the eyes. Right? So the virus enters the body via the mouth, via the nose, and via the nose. So the airborne transmission here, via the droplet nucleus, is usually through the nose, right? Then there is this contact here through the hands, and usually that may be through the nose or through the eyes, because we have a habit of indirectly touching our eyes every now and then. So that is one of the questions I was asked, how is it spread? So a spread is always from an infected individual who will produce droplets. The droplets may be transmitted to an individual who will breathe it in, or it will be indirect when a person will touch a surface where these viruses are, and then put his hands there and touch his eyes or the nose or the mouth. That's how it gets into the body. I put a picture here of somebody sneezing, right? Of coughing. This is coughing. So you can say that, you can see how it spreads here. Right? This is just an illustration. Now, the speed or the distance is depends on how it is spread from the mouth or the nose to the other person. If you are sneezing, right, your sneeze is very powerful. So usually the viruses will spread further if a person who is infected sneezing. Now, let me sort out a little bit of this confusion everybody gets why they should put on a mask. A droplet is a secretion from coughing or sneezing, right? And it tends to settle down into your mouth. That means it goes from one person, the infected person, to the other person. An aerosol is a liquid which is a little bit smaller, and then it remains suspended in air for a considerable period of time. Droplets drop down quickly. So if you are within a meter, you may get the droplet from a person because it drops down. While an aerosol is a little bit smaller than a droplet, so it will float in air for some time. And then if you're next to the person who has coughed or sneezed, this aerosol will enter your mouth, your nose, and that is how you will get it. The other one is contact. Contact meaning you are touching something where this person who was infected has put his hand. Now, the usual thing is a person will cough or we hold his nose, right? And then we put his hands somewhere. Now the virus is on his hands. That's why we are always told not to shake hands. So this person touches a tabletop. Then a person who is susceptible, not infected, touches that tabletop. The virus will go from the tabletop to his hands, and then to the mouth and the nose or the eyes, right? So you're always told, do not touch your eyes or wash your hands frequently. It's because this virus has the ability to survive on furniture. It has an ability to survive on.
So, sorry, doctor, can you speak a bit more louder? The last sentence.
Okay, okay.
Yeah.
Now I think I'll make it. Yeah. So the virus has the ability to survive on surfaces. So when it is surviving, it is on a surface, and somebody who is not infected touches that surface, right, with his hands, and then he's going to touch his mouth, then his nose or his eyes. So he will get infected through those membranes. The other possible way is through fecal matter. It's not been proven yet, but they found this virus in fecal matter, but they are not sure if it is live virus or just a particle of the virus, right? So major transmission method is a droplet, which is something coming out from the nose or the mouth. Then the droplet may either drop down or an aerosol which stays in there for a few minutes, 10, 15 minutes, depending on the environment you are in. Then you get it because of you have touched something where the virus is. Either it's a piece of furniture, a door handle, right, or a car handle, anywhere where the infected person has touched. Okay. Now, I was coming to this question: how do you get it by contact? Besides, there's one, as I mentioned, direct person-to-person transmission, right? That is through droplet and aerosol. Now, there's another study which found that the virus stays in an aerosol form for some about 3 hours in the room, right? So the virus may float around for 3 hours in an aerosol form. Now, as I said, these were experimental conditions, right? So a lot depends on ventilation, especially in a place where you're using air condition. You know, when you're using an air condition, you are actually basically breathing in recycled air, right? So the aerosols will tend to be, the virus will be circulating in the same room for a prolonged period of time because it's basically recycled air, right? So in a congested place, right, it will float around for 3 hours. Then another study which has also suggested that the virus can live on plastic or stainless steel surfaces for up to 3 days. That's why we are always advised to wash our kitchenware, etc. That is why it's very important to disinfect high-touch surfaces. That's why you're always told when you're opening your door, please make sure you disinfect the doorknob all over. That's why when you enter a supermarket, they'll give you a sanitizer. So you disinfect your hand, right? So if you are carrying a virus, you can kill the virus, right? So it's important to make sure that frequent disinfection of surfaces, high-touch surfaces, is also important. you wash your hands, but high touch surfaces, especially in a hospital setting, you'll find nurses cleaning their tabletops very frequently. In a supermarket, you will also find that the cashiers make sure that they clean the tabletops quite frequently, because a lot of people will come and touch the tabletop. Okay. Now, this is a very important slide, and it has to do with how an infection is spread. Let's take, for example, a person A. A person A is infected. He's your first case in the country or in the city, right? He has symptoms for 5 days, then he infects person B. Now, person B may not know he's infected, right? Then what will happen is, if you do not isolate this person, he will infect person C here, right? So the spread is person A to B, then it also goes to C. Then similarly, C will affect D, E, F. So one person has led to 5 infections. Actually, yeah, 5 infections, right? So one of the mainstays of controlling this disease is making sure that an infected person remains isolated so that he does not spread it. Right? It is for his good, and it is also good for the health of others as well. So because you are trying to control the spread of an infection. Remember, this disease so far does not have a cure. So what we all want to do is make sure that it does not spread. Right? So the spread is by droplet, right? So what you have to do is make sure that the person who got it, let's take, for example, person A, you have tested him. He is positive. He tells you he was in contact with person B. So what you do is you remove person B from circulation by isolating him, right? So he will not carry on the chain of transmission. It is very important that the chain of transmission is stopped. So you will control the disease. The only way is you make sure that you control the chain of transmission. That is what is meant by isolation. I had sent out a circular explaining the difference between quarantine and isolation. Quarantine is when a person comes into contact with somebody who is infected. So what they will do is they will ask you to be in a room on your own for 14 days, right? Now, they will take a swab from you to find out if you are positive or negative. If you are negative, they will let you go, right? That means you are not infected. You are put in quarantine to find out if they were infected. If your swab is positive, right, that means you are infected, right? So what they will do is they'll put you in isolation so that you do not spread the disease to the others. So that's a fundamental difference between quarantine and isolation. Quarantine is to ensure that you are.
Doctor, we are losing your voice again, please.
Okay, sorry.
Yeah, now it's okay.
Okay. So quarantine is to protect you from infecting the others, right? Isolation is also to protect people getting from infection from a person who is infected. So this person who is infected is put in isolation. Right? It is to protect, to make sure he gets treatment, but he does not also transmit the disease. I think a lot of European countries forgot this basic model. So what they were doing was they were not quarantining people, they were not isolating people. So the infection rates, infections kept on spreading. Kenya is a very conservative. Kenya, India are very conservative countries. So what they do is they find out if somebody is positive. If he's positive, right, he's taken into isolation. Then all his contacts are tested. And if the contacts are positive, they are put into isolation. So in some countries, they managed to delay the spread of the disease by simple method of what is known as contact tracing. It's very important here right now because we are in the early phase of the epidemic. Once we get into 10,000 cases, right, it will be impossible to stop the spread because you will not be able to trace the contacts. Now, the infected persons may be, there are some who are known as super spreaders. Now, there is a case reported where one person actually transmitted the infection to 72 people, right? So that's why we have to be very careful about making sure that we isolated the infection, those who are infected. Other thing is we also have to find out where the high risk areas are of spread, right? Usually we say in a crowded place, yes, it is true, right? Then the other thing is in India, they found that two common things they had actually forgotten was the truck drivers who was the super spreaders, right? And the other one was the marketplaces. So there was a marketplace in South India. One person there transmitted it to a few people there. And from there on, they were able to calculate that the infection spread to around 6,000 people, right? So a marketplace is a very common place to get infection. Truck drivers drive from one state to the other state. They have the infection, they come into contact with many people, so they infect others. So that is how in the European Union, the infection has spread from one country to the other. It has been, you stop the flight, but the truck drivers are there. Same thing happened with Kenya. We found a lot of people with infection coming from Tanzania, right? That's why I think the border was closed yesterday, right? Now, why do we take all these measures of isolating a person, putting a person in quarantine? Now, if we do not take this, what will happen is, let's take, for example, this is day 1, 0 cases. We do not take any measures, then the number of cases will rise dramatically. Right? There will be so many that we will not be able to handle it. But with protective measures, and I'll come to the protective measures later on, the spread will not be that much in a short time. The spread will not stop, but it will be a smoother spread so that people can cope up with the spread, right? Now, let me give you a theoretical example. Let's assume that the bed capacity of England is 5,000 people, right? Now, if they get 10,000 people here, the system is strained because they do not have enough beds, right? But if they had taken these measures earlier on, they would have been able to contain the situation. At least the system would have been able to handle the system. It does not mean that the cases would have increased or decreased, right? But what happens is that that spread over of the cases would be over a longer period of time, right? Such that they can be looked after. But when you have this sort of situation where you have 10,000 cases in a period of 2 months, and the system just collapses. Now, the incubation period is between 5 to 6 days. The incubation period means when you are exposed to the disease and you get the symptoms, right? On average, it is 5 to 6 days. But it can be up to 14 days. Now, there is a time that you may not get symptoms. That is the pre-symptomatic case will occur without any symptoms. So average onset, average time of incubation is 5 days, but there are some cases who may not actually get symptoms. So these are the ones who are very important, because these pre-symptomatic cases are the ones who can spread the disease further. Right? Now, what happens with this? This is your virus, right? It attacks your, just give me 1 minute here. I have to look at the other one. I'm sorry. Okay. Now, it gives you common symptoms is fever, dry cough, and tiredness. People with COVID usually 3 common symptoms: fever, dry cough, and extreme tiredness. Then the other symptoms which are there are headaches, nasal blockage, a sore throat, then we'll be coughing out something. The other one which would be uncommon is shortness of breath, but when you get it, it is severe. You also get pain in the muscles, then you feel cold, right? You may have nausea or you may have vomiting. You may also have diarrhea. Then in severe cases, you may have high fever and you may cough up blood. You may end up with kidney failure as well. So common symptoms, I've got it here for you. Fever, fatigue, then the respiratory symptoms, right? Dry cough, shortness of breath, right? Very common, they're short of breath. And that is not a good sign. And the disease can lead to pneumonia. Symptoms usually occur, as I said, between 2 to 14 days. Average is 5 to 6 days. So you are exposed, average of 5 to 6 days, you will be having your symptoms. However, as I have said before, many people may be infected but show no signs of symptoms. I'll put it down again. I cannot emphasize this enough, and I have to go over this again and again, since many people have actually called me up if they have a cold, do I have COVID? So these are the common symptoms: fever, dry cough, shortness of breath, fatigue. Uncommon: headache, blocked nose, sore throat, productive cough, muscle pain, chills, nausea, vomiting, and diarrhea. Right? Now, the next slide is, these are the symptoms they saw in China. The commonest symptom they had was fever, dry cough, and tiredness. So it's a combination of those three, you should actually start getting worried. Fever, dry cough, and fatigue. Then some will produce something, productive cough, shortness of breath, muscle pain, right? Those are the signs, common signs. Now, I mentioned disease is mild in most cases, but there are some danger signs you should always look and you must seek to look for, and you must seek help urgently. If you have trouble breathing, you have persistent pain or pressure in the chest, and you have started getting confusion. Now, I've written here new confusion. Now, it's because, okay, in elderly people, a lot of them are in England and in China, they would seem confused even if they didn't have COVID. But that they found when they were getting COVID, that level of confusion would increase, right? Then the other thing which they noticed was inability to wake up or stay awake. So you would find this patient who would be drowsy all the time. That is because of low oxygen levels. The other dangerous sign is a blue lip or a blue face. That is because you do not have oxygen. Now that is a really time for you to seek medical help. And the other one is drowsiness, right? You feel drowsiness, right? You are in a problem, seek help. How is COVID diagnosed? Very simple method, right? It is, you use a test which is known as a PCR, right? Results can be obtained from within a few hours, 4 hours, or it may take even 2 days. Now, this is the most accurate one. There are others which have come into the market, but they are not reliable. A lot of countries were using that, they've actually stopped. There was a blood test which became very popular, but then there was a problem with the accuracy of the test. So virtually everybody is, for clinical diagnosis, is using a swab to diagnose. But a blood test can be used when you're doing surveillance. So don't get frightened because of this picture. It's just a thing they put in your nose. It's a very simple swab, right? The procedure takes about 3 to 5 minutes. They'll put a throat swab in your nose, and the other one they'll put in your mouth, right? There are other tests which can be done, not necessary all the time, but if you're in a hospital setting, CT scan of the chest, hemogram, a CRP, D-dimer, renal function, or troponin level. This is if you are very sick. If you don't, or in what is known as or you call it in a particular risk group, they will do all these tests. But if you're not in a risk group, you will not do this. In certain countries, because of large numbers of patients they are seeing, they are not able to do the swabs actually and get results quickly. So what they do is use syndromic approach. So they ask you, what's wrong with you? You're having cough, you have a headache. So in those countries, they will use syndromic approach. Now, question I was asked, how do you protect yourself? This is the most important thing. If you do not go away with anything from here, just go away with this message, right? Sanitize. Wash your hands often with soap and water or alcohol-based sanitizer. Do it frequently if you're out shopping. It is most important. It's the most important thing. Social distancing. Stay about 6 feet away from other people. Evidence suggests that the virus can be spread by people who seem healthy but are infected. So a lot of our people actually look healthy, but they may be infected. Avoid touching your face with your hand. So do not touch your face with your hands. And the common mistake is you're wiping your eyes like that. It is a common thing people do. The virus is in the hand, so it will get into your eyes and then into your lungs. Wear a mask. The most important thing, you will find a lot of material on YouTube. Wearing a mask is useless. Wearing a mask is this. Do not listen to some of those things you get on social media. Wear a mask if you are out of the house. Get a flu shot. Essential. We don't do it here because we don't think it is necessary, but I think it should be done routinely every 6 months. Eat healthy foods, fruits, spices, which improve immunity. If you're a smoker, stop smoking, because if you're a smoker, what happens is the disease will be more severe. Another question I was asked is, what is the severity of the disease? All of you should relax a little bit. 80% of cases are mild. They only require treatment of fever. That's all, right? 15% of patients will require oxygen. That's the only thing they will require, right? It's only 3% who will require intensive care treatment, and these are the patients whom we should be worried about, because our community is made up a lot of these patients who are elderly, who are over the age of 65, are obese, have diabetes, have hypertension, are smokers, right? And these are the ones who will develop severe disease. They are not more predisposed to get the infection, but what they will get is, if they get an infection, they'll get a more severe disease. So a young person, let me get back to my slide here, right? Now, sanitize, okay. Okay, I'll come back to it later on, okay? Now, this is data from China. This is data from Europe, 80%. In China, that 81% mild cases, 14% severe cases, 5% critical cases, right? Now, let me come back to a situation which is very unique in our community, right? We have a person, let's say person A. He has a son, so I'll call him B. He is staying with his father, I will call him C. So the son will go out to school or is out playing. The son will bring the infection, right? To the son, whom I have said is B, will bring the infection. Now, the son will be absolutely all right. He will not have anything wrong with him. He may not be having a fever. But what will happen is he will give it to the grandfather, right? The grandfather who is over 65 years of age, who has diabetes, has hypertension. So you find that this is a common thing which has happened in England, it has happened in the US, because we tend to live in houses where we look after our parents and we stay with our children. So the disease has been specifically, the Asian community has been specifically hit in Europe because they stay with 3 generations, the grandfather, the son, and the grandson together. The person who is most susceptible is the grandfather because he's elderly, 65. So, and that is the same thing in our community here in Mombasa. We may be staying in a flat, but remember, you'll be having your father with you, you'll be having your mother with you, you'll be having your children. The child is going out to play, right? He'll pick it up from the other children. He'll bring it home. You are 35 years old, you may not have symptoms, or you may have a few mild symptoms, but then you'll pass it on to your grandfather, right? Your grandfather is 65. He's diabetic. He's hypertensive. He's a little bit obese, right? So it's the grandfather who will get it. He gets it, but he'll get a more severe form, requiring more severe intensive treatment. Now, coming to treatment, most important thing is prevention. If you listen to the news today, Kenya has reported the highest number of cases today. And the highest number of cases were actually in Mita County, that is the Mombasa Island, right? So the highest number of cases by city is Nairobi. But if you look at by sub-county, the highest number of cases in Kenya is actually in Mombasa Island, Mita Island, right? So we are living in an area where this disease has become endemic. It is very important that we take precautions, right? And I have mentioned the precautions: sanitize, wear a mask, do not go out to marketplaces, avoid congested places, right? That is specific to both the elderly people and the young ones, because as I have mentioned, the young ones will bring it to the old ones. The young ones will survive. The old ones may not survive, right? What are the treatments? There is no vaccine. Work is underway to develop one, but it will take at least about a year. There are no drugs, right? Symptoms are managed using standard methods of care for viral infection. Meaning if you have a fever, they'll give you paracetamol. If you're dehydrated, they'll give you some IV fluids. Antibiotics are of no use, right? Several drugs have been sort of reported to be useful, right? Especially in the papers. Chloroquine, azithromycin, lopinavir, remdesivir. None of them has shown to be effective, right? As of now, though they are using it, I think it is because out of compassionate use, because we do not have anything to give. You try and give them something to ensure that, you are a patient always wants to have something to make sure he's better. So the doctors will give it. In Germany, they do not use any of these drugs. In Germany, what they do is they just look after their oxygen requirements. Now, as I said, one of the commonest things they have is difficulty in breathing, their face turning blue. And what they will do is give them high flow oxygen through nasal cannula, right? Which is very simple. It's oxygen through nasal cannula or a non-invasive ventilation. They just put a mask over you and the mask will assist you in breathing. And then worst comes to worst, you get severe, then what they will do is put a tube into your lungs, right? And that is in intensive care. I hope we do not get to that stage because intubation is very labor intensive issue. It requires a lot of skill. You have to be in ICU. Doctors in ICU are scared of intubating you because they think they will get the disease. So they try not to intubate you. Secondly, the results out of intubation in an ICU are not good in other parts of the country or other countries. Let me give you an example. I was in a meeting, a webinar with somebody from New York, and there was an Ismaili lady who used to work in Aga Khan Hospital, Dar es Salaam. She's now working in New York City. And what she said was, she was working in the emergency unit. She said that 85% of patients in our hospital who went to the ICU, were intubated, died, right? So that is one example. That's from New York. Then there was the other person who was from Germany. He said they didn't lose anybody, right? Then there was another one from Spain. He said they were losing around 60% of their patients if they were intubated. So intubation is something which we try and avoid. And as I said, doctors are very reluctant because they are scared of doing it. Then the other thing they will do is they will anticoagulate you, especially if you are in an intensive care unit, because what you do is you develop blood clots, which and you may get a pulmonary embolus, right? So what you are doing in COVID treatment is not treating the disease. What you are treating is the symptoms, right? In this case, you are treating them symptoms which are there in the lung, low oxygen, right? So you're giving them oxygen. If high flow nasal cannula does not work, you will give them non-invasive ventilation, right? If that does not work, let's hope now we don't get to that stage, they will intubate you. So the treatment is basically supportive. And as I said, in this era of COVID, people are scared. Doctors are scared because if they are exposed to a patient, that means they have to go into quarantine. I know two doctors right now who are on quarantine. I know two doctors, right, who are friends of mine, who are in isolation because they have COVID, right? But because they are young, they seem to be doing well. Unfortunately, amongst the two, one was staying with the parents, with the mother. So the mother is, the one I was talking about is out of this country. So the mother is actually in hospital because the mother became very sick. So doctors are also very scared of this thing. And I think it will take some time before the doctors become very confident to work. It will take a long time before we actually go back to normal. Now, one of the other things which I find which is already happening is mental stress. It has been reported in a lot of patients, in relatives, and also amongst those doctors and nurses. A lot of mental stress because they are scared of infection. Then there is the socio-economical states, the economic status which is there in the country, which is affecting a lot of people. So they get mental stress. Then there is too much information on social media, right? There are 7,500 articles published from January up to April 30th. There are 7,500 articles awaiting in line to be published. That means 15 articles starting from January, that's in 4 months, right? So a lot of articles which are coming in the medical journals, a lot of them have not been reviewed, right? And a lot of them may not be accurate. There's a lot of information on social media. You'll find discussion on masks. Masks are useful, not useful. Washing hands is useful, not useful, right? News media is preoccupied with COVID. So you open a newspaper, you read about COVID. You open your news channel, it is COVID. So I think with this rapidly changing field, new findings are published. A drug which was recommended, let's say, a month ago. Let's take, I'll give you an example. Chloroquine or hydroxychloroquine was recommended 6 weeks ago. But with the new findings, it is no longer recommended, right? Now, there's a question I was asked, what do you do? What do I do if I'm sick? Stay home when you're sick. Cover your mouth or sneeze with a tissue and throw the tissue in rubbish. Regularly clean and disinfect frequently touched objects. If possible, try to be away from the family. Lock yourself in the room. Right now, they are not allowing self-isolation at home in Kenya, but I think very soon they will allow it. So regularly clean and disinfect frequently touch objects. If you're touching a door handle, disinfect it with Jik, with Dettol, anything, right? Anything is useful than nothing. But if you develop symptoms such as fever, respiratory symptoms, difficulty in breathing, then call a doctor. Right. Most important. Okay. COVID is an infectious disease of the respiratory system, right? Caused by SARS-CoV-2. It is relatively mild with fever, dry cough, shortness of breath, and fatigue. Fatigue, as I said, tiredness. So if you notice somebody in the family is having that, please report that. Older patients and other at-risk populations may develop life-threatening symptoms, right? I mentioned at-risk populations are the ones who are obese, have diabetes, have a high blood pressure, right? They are the ones. There is no vaccine or specific treatment. Protect yourself by sanitizing your hands frequently, maintaining a distance of 6 feet between your people, always wear a mask, and avoiding people and places known to be infected. Right? We know there are always crowds in a market, right? We know that certain places in Mombasa, the infection rate is high. I would suggest, to be on the safe side, you avoid going to those places, right? Avoid going to the market. It does not do you any harm, not to have vegetables for 1 or 2 weeks, but a market is not a good place because people in the market come across a large group during the day, right? So you may have somebody coming from one place. So one person in the market may be in contact with 100 other people, right? And he may not be very particular about his hygiene. However, if you have to, yes, go. But you must make sure that you take the preventive measures. Put on a mask. Stay 1 meter away. It does not appear rude if you're away a meter, right? Mask. Sanitize your hands after touching the fruit, right? Most important, it's mask, sanitizing your hands with a sanitizer. Soap and water is equally good. Avoid places and people whom you know are infected. So if you know a person is sick in the hospital, he's your relative, right? He has COVID. Please do not go and see him. They will not allow you to see him. But please do not go and see him because you are at risk. He's not at risk. He's going to infect you, right? But do not, please. Thank you. If there are any questions, I'll take them now.
Thank you, Doctor, very much. There are a couple of questions. Let me start asking from the very first one. There's a question: if it is safe to order food from the restaurants. These days, the most of us are staying home, and then we are asking, getting foods from restaurants. So there's a question whether if food to take away foods are buying from the restaurant, is it okay? Is it safe or not?
It is safe.
It is safe.
It is safe, yes.
Okay. Okay, you got your answer there. It is okay to order takeaways from the restaurant. I think so. It's just the packaging, anything you can discard it. The one a person is carrying, right, doctor?
Yes. Yeah.
Okay. Second question is when you said it is airborne. This disease could be this virus could be airborne. So I think so. You already explained that, but if you can put a little bit light on that one.
Let me go to my slide, okay? Let me go to my slide. Okay, this is the slide, okay? So this guy is coughing, right? Now, what happens is there are droplets. If it is a droplet, it will fall to the ground, right? So if you're coughing next to a chair, if there are droplets, they'll cough and fall down to the ground, right? So, or the chair. So the chair is a source of contamination. Then that droplet will turn into an aerosol, which is much smaller, and it will survive for about 3 hours in the air. So it's not airborne as such, but it will survive in air in aerosol form for about 3 hours, depending on the conditions, depending on the ventilation, the humidity, etc. So the aerosol will survive for about 3 hours in the air.
Thank you, doctor. Another question is, many one of us have the maids and drivers who go into public transport, who go in and out of our houses. How safe is that, and what is the way forward as far as they are concerned, our house help or our maids or our drivers? How do we go about it?
I think this is a very difficult question, right? Because unless you train them, right, to make sure that they put on a mask if they're in matatu or on the ferry, right? When they come into the house, make sure they wash their hands, right? Make sure that they put on a mask. I think, the young people do not have to worry. It is the elder ones I'm worried about always, right? Because the elder ones are the ones who are going to get more sick. The younger ones, the ones who are below 60, are okay. They can survive. It is the elder ones who are at risk. So yes, the house helps, the drivers are a potential source. But I think it is up to you to make sure they remove their shoes before they enter the house. They make sure that they change their clothes, right? Wash their hands frequently, and make sure they put on a mask, right? And you don't have to be talking with them a lot during this time. Maintain that distance in a house, because I know a lot of us cannot do without their help. But if you're going to use them, I think we have to adapt to the new situation we are having.
Right. Thank you, doctor. And one more question. Interestingly, they are saying one of your slides said that the virus droplets or whatever last long on metals. So how safe is to wear rings? Question is, most of us wear rings in our community.
So I will leave that. I will leave that question, please. I'm not able to answer that. Sorry. Yusuf, sorry.
Okay. The
There is
question
no
was
study.
Yeah, I understand that. It may have some other implications around that one. I'm not talking about the wedding rings, doctor. I'm talking the normal rings.
I'm trying to sort of avoid. There is no. I don't have an answer for that. Sorry.
Doctor, we move on. There's another question is on just now I have received. Is it possible for the one who is infected to get it again? Can a person be infected by the virus like twice, thrice?
Difficult to say. No studies so far. Remember, there has only been one major outbreak which has been dealt with, and then that is the one in China. They are not sure. Some doctors or some journals are saying yes, because you have got the antibodies, you are protected. Others are saying no, you are not protected. I don't think anybody is in a position right now to say yes or no. Now, while you are saying that, is one of the treatments which is being used right now is plasma from a person who has recovered from COVID. So what happens is you have had COVID, right? You've got the antibodies. What they will do is they will take a swab from you. If the swab is negative, right, that means you don't have active COVID, but you have antibodies in your blood. So what they'll do is they will take your blood, then they will refine it into several components, and they will give you what is known as convalescent plasma. It has been used and quite successfully as well.
Thank you, doctor. Doctor, next question is on the test. What is it possible to do the voluntary test? And if it is, how much is going to cost?
Voluntary is, I mean, you just, the government is carrying out those tests, right? And it is free. The other place you can do it is, and actually Dr. Mandalia was supposed to come and talk today on the testing part of it, but because the webinar is, and he's going to I've organized a webinar for our community after Ramadan, but an earlier time, 8 o'clock. 10 o'clock was a little bit late. So it can be done in private laboratories, and that is Pathcare, and there's another one. Right? It can be done, but it can be done by the government. Just find out. But when we had the exercise at Old Town, surprisingly, the only one from our community was myself. There was nobody else who came.
So, doctor, personal question. You were tested, right?
Yes.
Okay, so it means
Voluntary, I was negative. Don't worry.
okay, no, that's fine. Okay, well, another question has just come in that what are the instant home remedies, if any? And the second related to the question is, I think so, what can we do to boost our immune system as to fight the virus if infected?
Okay, I've got it as well. Now, I think zinc is helpful. Zinc supplements.
Right.
Check that, right? A lot of people, I think Dr. Jaffer from America actually talked with us about herbal therapies. His video is still available on YouTube. And he was talking about having turmeric, ginger, and those spices. Yes, no harm, may not help, but definitely, and they're not going to harm you. Zinc, no harm, but it will help you. So try. Okay.
Right. Okay, doctor, interesting question. Is it safe to go to barbers?
Right now, no. They have actually, by law, barbers are supposed to be closed.
So by law, it is closed. So basically,
yes.
I understand that. So I think so that Salim answers your question that going to barber by law is prohibited. But I can see many people in our community going back doors. Is it safe?
I would not recommend it. To be honest, I would not recommend it for the time being. Okay, because you are in a very closed environment, right? You know, barber shops are very. They are not spacious. A supermarket is spacious, right? So this one, a barber shop, is a confined thing. So you do not know. I would not risk it for that, at least for now. We have 3 weeks only.
Right. Thank you. I think that is the list of the questions I had. If anyone has any questions, maybe let us know. Let's give them a couple of minutes more before we end up. All of you who are there online, if there are any questions, please let us know now. Whatever we had received, we had answered. We had questions regarding the safety of the food, takeaways, whether it is airborne or not, the behaviors of maids, drivers in public transport, rings on the fingers. Yes, doctor, another question has just come down that many of us, as per this discussion, may not show the signs. So how safe are we all? It's a difficult question, but they're asking what is the safety percentage if nobody and many are not showing the signs?
Yeah, it is one of the big concerns everybody has, right? That you may be asymptomatic, and that is a worrying thing. We do not know in Kenya how many are actually asymptomatic, but there are people asymptomatic walking around. So the universal precautions should be taken. Let me give you an example. A patient will come to a hospital to get his blood drawn for any purpose, right? But the lab person has always been told safety first, right? Because of HIV. So she will always put on gloves and take the blood, right? And then discard the syringe, right? Now, the blood patient may have come for blood sugar, hemogram, but the lab technologist or the technician has been told AIDS is a problem, make sure you protect yourself, right? Because you assume it is everywhere, right? The same thing with COVID. We should assume it is everywhere for the time being and take the standard precautions. There is no way out of this, please. I think let our community members understand this. You are in a lift. Lift should hold 4 people, not more, right? That's it. Take that precaution. Don't take a risk. Right?
Okay, doctor, related to same thing, it's asked by one of our ladies that going to the work, how safe it is. I'm saying they have no choice but to go to the work. So how safe it is, provided they are taking the precaution and all that.
Thank you, Yusuf. I go to work, right? And I go to work in Old Town, which is high risk area, right? Some of my patients may be having it, but what I do is I make sure that I put on a gown. All my staff put on a gown. All of them put on a cap, right? Then they put on a mask, and there is a sanitizer, right? So these measures, I think, for the next 2 years, will become standard practice for all of us.
I understand that, doctor. So basically, you take precautions and then you have to live with it. Doctor, very interesting question. There's another lady who's asking zinc. How can we get them? Are they in form of tablets, or if they are, what are the tablets called?
Zinc is available 20 milligrams, available at all chemists. Helpful to boost your immunity.
Okay. Another question from one of our brothers. Okay, I think so. You have understood the zinc we can get in a tablet form. It's 20 milligram available from, I think so, from all the chemists.
All the
everywhere?
chemists, yeah. Yeah, yes.
Okay. Now, another question here is, do you have to worry about your regular sneeze? There's a person who is regularly, like, he sneezes even before the virus was there or not. Are we supposed to be concerned?
No, no. I mean, as I said, it is, you must have not just one, you must have other features. No, sneezing is usually not a problem. It is the dry cough, it is the tiredness. The other thing which has become very prominent these days and which is being reported from all over the world is loss of taste.
Loss of taste, correct, yeah.
It wasn't reported from China, but in England and in the US, they are reporting that loss of taste and loss of appetite is a very significant finding in most of the patients. So if they lose their sense of taste, I think that's one of the questions they are asking these days. Have you lost your sense of taste? Have you lost your appetite? Right? A lot of patients, because they have lost their smell of taste, they're having fever, they have lost their appetite, may actually become dehydrated, right? Because they are sweating because they have a fever. So a lot of patients here in Africa, and I'm talking about Mombasa, and I've also talked with other doctors here. They've said is the classical teaching is that, especially in Europe and America, don't give them fluids because those fluids will flood the lungs. But what I've been told here is that because these patients, we are living in a hot environment, the temperature here is 30 degrees, right? The patient is febrile. He has not eaten for 2 or 3 days, right? So actually, when you give them fluids, they actually feel much better. So in Kilifi, those patients actually felt better when they got their fluids, right?
Right, right. Doctor, another question here is from a very young chap. Calling relatives of home, is it safe to call relatives of home, or we have to tell them, no, get yourself tested or something like that? Can we call our relatives home?
No, I think, I am trying to very antisocial, but I think Molana will forgive me. Okay. Right now is not the time to visit your relatives, please. If you're a young person, you may be infected, right? So do not go around and spreading your infection. You get tested, then you can visit your uncle who is 70 years old. Right now, please, right? Unless you are tested, do not. Call them on the phone, talk to them, be nice, right? But do not go. Right now, until we know the exact situation, I think people are not understanding the the severity of problems of the problem in Kenya or in Mombasa. You see, we are not testing those large numbers, but even with the small numbers we are testing, we are finding very large positive cases, especially in Mombasa. So we do not know how far spread this infection is, right? So it is better that for the time being, leave the senior citizens at home, right? If you are really nice, call them up or pass by, but don't go inside.
Right. Doctor, I think so you have made it very clear. So it's a young chap. So if you have old relatives, try and avoid visiting them, but you can call them and everything. Now, the same related question, I think so it is, I can answer that, but I will let you answer that, that do we have to be scared of the virus and do we have to make people scared of the virus? I think so that is what we've been talking all about, is taking precaution. But how would you answer that? Do we have to be scared of virus or you have to make others scared of virus?
No, I think we don't have to be scared of the virus. The
Right.
thing is, you take precautions, and that is it. You lead a normal life, right? It is, the virus may be here. Somebody asked me a question, how long is the virus going to be here? I do not know. WHO tells me it is going to be here for 2 years, right?
Oh.
So nobody actually knows how long the virus is going to be. But the thing is, you can always prevent yourself from getting it by taking simple measures. Wash your hands, sanitize, put on a mask. Right?
Thank you,
Simple,
Dr.
simple, simple things.
It's very clear. Dear brothers and sisters, my elders, and my younger community members, is there any further questions you would like to ask? Because we are running out of time, and we'll take 1 or 2 questions if there are any. I'll give you a minute or so.
There's a question here I have. Okay, sorry, Yusuf.
Yeah, yes, please go ahead.
How long will Corona last? When will traveling be allowed? As I said, I do not know how long the COVID-19 will last, right? And I do not know how long, when we will be allowed to travel, right? It is, I'm not the decision maker. As for how long, I don't think anybody knows, right? Everybody, it's like China. China thought they were safe. Now they are getting cases. Korea thought it was safe. They are getting cases again after reporting no cases. So it's not that the disease is going to disappear. It is going to be there until either we get a vaccine or we get effective drugs. Or we may not even get the effective drugs.
Doctor, I got a question. It's interesting and it relates to asthma. A person who is having asthma and can they have a medical exemption for wearing mask outside? Okay, outside they have to wear, but alone, like they are in their own vehicle or away from the people. I think, let me read it out. For a personal experience, can those who have breathing problems like asthma have medical exemption in wearing masks, face masks outside, but alone, like in their car or away from the people around them?
I don't think it is compulsory to wear a mask when you are alone. I know the police harass us, but I looked at the legal notice. It says a mask in a public place, but I know how it is. But I think if you're alone, you don't need to put on a mask. But if you are in a workplace or you are outside in the market, and I think a mask is essential for somebody who is an asthmatic. And one thing, she's an asthmatic. Okay, one of the things which has now been discouraged is nebulization, right?
Okay.
If you're an asthmatic, what happens is when they nebulize you, there are a lot of these droplets coming around, right? Now, you can do it at home, but in a hospital, a lot of hospitals have stopped doing it because what happens is it produces a lot of these aerosols, and these aerosols can infect the staff. So a lot of hospitals have actually stopped doing nebulization.
Doctor, one more question from my sister here. Is the loss of the sense of the smell only with no other symptoms at all 100% COVID? Like you have
No,
only
no.
one? Okay.
No.
So
You must be having others.
Okay. So sister, you got it clarified that loss of smell is not the only symptom. You must have other symptoms combined with that. Another question is how accurate are the tests? How accurate are the tests?
Okay. The test is 70% sensitive. It means if it is positive, it is definitely positive, okay?
Right.
Because it has a very high specificity of around 95%, right? But in general, it is sensitive 70% or 75%. Now, the reason a test is negative in a person who may be positive, and that's why they usually do two, is because you have collected the sample either too early in the disease, right? Or there is a problem in transporting the swab to the laboratory. Any of those problems will give rise to a false positive. So you may be having the virus, but the test will be negative. But if your test is positive, you are definitely positive. It is unlikely that the test will give you a false negative and will say that you are negative while you are positive. But if the test is positive, it is definitely a positive test.
I think that clears questions. There are two of these similar questions on the test. I think that the last question would be, can you go out for a walk or a jogging out in the streets?
I see no reason why you cannot go out as long as you have your masks. We have taken the precautions, but I think knowing our community around here, if you are going out, you'll be met by your friends, right? So you will start talking, and there'll be a community gathering around. So instead of having one person who is walking around, there'll be 5 or 10, right? So we are trying to limit social interaction. Yes, but there is absolutely no problem in going out. And as I said, I think I should say it, exercise is actually good for the elderly people. They should go out, but with precautions. But the worst part of our culture is that we like to say hello to everybody, shake hands, everything. So if you can avoid that, I think, yes, go out for a walk. It is good for you. It is good for your mental health and for your physical health.
Thank you, Doctor. There is one last question, but I think it's very straightforward. If you are in an area where there is no lockdown, is it necessary to take precautions, all the measures for the COVID?
Let me be very simple with this question, right? Now, even if this 7 to 5 a.m. curfew is lifted, right?
Right.
Even if the lockdown in parts of Mombasa or in Nairobi are lifted, right? A mask is a must if you're in a public place. Okay, so even if you are in, let's say, Nakuru or Kisumu, where there's no lockdown, but there's a curfew, a mask is a must. Even if the list remove these restrictions, a mask will be a must. Even if the government doesn't make it a must, for your own sake, make it.
Right. Thank you, Doctor. I think so. We should end up. We are over 1 hour and 20 minutes there. And I thank you. Thanks a lot, Doctor, for your.
Thank you very much. Sorry for the low volume here. Sorry.
No, it's okay. We are learning. So every day is a learning process. Thanks a lot to my media team. And thank you all the participants and for your brilliant questions. Thank you very much. We are going to end it now. Thanks a lot. And be safe.